Ladies and gentlemen, you are warmly welcome to the part 2 of Daniel Hayford's lecture series on the theme, an overview of adolescence and reproductive health. This lecture covers 5 important topics. 1. Sexually transmitted infections or STIs, and therefore sexually transmitted diseases or STDs. 2. Contraceptive methods for adolescents. 3. Harmful traditional practices or HTPs. 4. Gender-based violence or GBV. And 5. Adolescent and youth-friendly sexual and reproductive health services. Did you know sexually transmitted infections or STIs, including the one I refer to as the infamously famous human immunodeficiency virus or HIV, syphilis, and gonorrhea, are truly common among the adolescent population for 3 reasons. These 3 reasons are biological, psychological, and socio-cultural reasons. Biologically speaking, adolescent girls are more susceptible to sexually transmitted infections than older women due to their immature vaginal mucosa and their cervical tissue. Furthermore, our adolescent people, be they adolescent girls or boys, are more likely to involve themselves in unsafe sexual practices. Some of such unsafe sexual practices are 1. Possessing multiple sexual partners, and 2. Having sexual intercourse with a date, a boyfriend, a girlfriend, or a next-door neighbor whose STI status they do not know. These days, it has become very important that each one of us should exercise self-control to abstain from casual or spontaneous sexual intercourse with people to whom we are not legally married. In case there are people who do not want to abstain for long, they should still do well to exercise some self-control and get to know the STI status of a person before they choose to have sex and, for that matter, sexual intercourse with that person. This is due to the fact that, apart from abstinence, no contraceptive methods are 100% safe for preventing any of the deadly sexually transmitted infections. Ladies and gentlemen, 2 other unsafe sexual practices associated with adolescent people in Africa and other parts of the world are 1. Having sex and sexual intercourse with the so-called sex workers or prostitutes, and 2. Not using condoms. Dear friends of Daniel Hayford, such unsafe sexual practices put the adolescent people at risk of STIs and therefore sexually transmitted diseases. It is therefore not surprising that HIV is prevalent among adolescents. Data from the UNICEF indicates that in the year 2020, up to about 2.19 million adolescents were living with HIV globally. and that adolescent people account for approximately 4% of all people living with HIV and about 10% of new adult HIV infections. This unfortunate situation is attributable to the fact that the world's adolescent people commonly lack the right fundamental information regarding their own sexual and reproductive health issues. Undeniably, another unfortunate situation is that a considerable proportion of the adolescent population are ignorant about the mode of transmission or spreading of sexually transmitted infections, as well as the symptoms and treatment of such infections. In some rural settings on the continent of Africa in particular, adolescent girls are married at a very early age and they are not empowered well enough to say no whenever it is necessary for them to do so. In fact, some of these girls are actually forced into those marriages. In some places, ladies and gentlemen, before the marriage rite is performed, some of the girls are made to engage in sexual activity with older men through puberty rites. And those men are actually paid some amount of money for that unfortunate service. Can you imagine that, ladies and gentlemen? Can you afford to imagine that? Of course, I know that you are intellectually curious and that you will conduct some research and find out the places in Africa which have been associated with such puberty rites in the past or perhaps currently. What role do you seek to play in abolishing such a very harmful traditional practice? Do well to present your response as comments. Another unfortunate thing which is going on right now and right here on the continent of Africa in particular, and most of the low and middle income countries, is that appropriate information on sexual and reproductive health of the adolescent population in particular is not available to a considerable proportion of this population. A consequence of this situation is that adolescent girls may end up having their first sexual experiences with older men, while adolescent boys may have their first sexual experiences with prostitutes or the so-called sex workers. And both behaviors increase their chance of getting and suffering from the scourges of sexually transmitted infections in significant ways. Dear friends of Daniel Hayford, sexually transmitted infections in adolescent people can most probably result in multiple long-term negative consequences for their health, economic life, as well as their socio-cultural life. Did you know such highly preventable infections in adolescent people can also lead to their early death? Too bad. Ladies and gentlemen, the documented negative health-related consequences of sexually transmitted infections in adolescent people include pelvic inflammatory disease, chronic pelvic pain, fetal death, ectopic pregnancy, cervical cancer, and related maternal death or mortality. Did you know chlamydia and gonorrhea can also result in infertility, particularly in female adolescents? Furthermore, chlamydia can lead to pneumonia in infants. In addition, neonatal gonococcal infections of the eyes can cause blindness in the adolescent victims. And syphilis in adults can cause serious heart and brain disease, which can be fatal to the victims. Ladies and gentlemen, children, adolescents, and young people can get infected with the major STIs such as the HIV and syphilis in two ways. One way is by means of infection from their own mothers while they are pregnant or during delivery or at birth, and through breast milk. Fortunately, in case mothers receive treatment for HIV, for example, during their pregnancy, the risk of passing the virus to their babies can be significantly reduced. The other way the adolescent people acquire HIV or eventually AIDS and other STIs is when they choose to practice an unprotected sex or they are forced into having an unprotected sex. Friends of Daniel Hayford, this infection history has a significant impact on one, the way the HIV menace affects an adolescent person, and two, HIV-related care and management. Did you know, just as it is with prevention of all other infectious diseases, HIV prevention necessitates active participation of all members of society, including adolescents, parents, guardians, teachers, role models, governmental leaders, the media, individuals living with HIV, and those with the acquired immunodeficiency syndrome or the AIDS itself. In general, behavior changes of all people in society, including the adolescent people, do take time and do not always automatically follow awareness campaigns. I repeat, in general, behavior changes of all people in society, including the adolescent people, do take time and do not always automatically follow awareness campaign. Accordingly, it is very important that our healthcare providers, counselors, parents, and all who are involved in the quest to eliminating infectious diseases among the adolescents to do one very important thing. That is, they should make sure that they provide continuous support whenever they counsel adolescents who are already involved in certain form of risky behaviors to help them accept, plan, and implement healthy behaviors. Determination, patience, and perseverance are key. In addition to health promotion campaigns and education of the adolescent on how to prevent STIs and what those who already have HIV should do to stay healthy and prevent spreading their cases to more people, there is a need for program planners and implementers to make condoms available to the adolescents and refer them for good counseling and HIV testing. But first and foremost, the adolescent population should be informed that abstinence is truly the best way forward, and they should be provided with the right environment and support to help them abstain until they are legally married. Look, it is possible. Ladies and gentlemen, what are the contraceptive options for the adolescent population? To begin with, take note of the fact that adolescent girls who become pregnant too early in life are at significant risk related to sexual and reproductive health, and therefore their well-being. Friends of Daniel Hayford, take note of the fact that pregnancy in adolescents before age 18 years comes with even more serious health risks like obstructed labor, prolonged labor, hypertension, unsafe abortion, premature birth, and stillbirth. Such premature pregnancy also has socio-economic and psychological consequences for both boys and girls. Due to the fact that pregnancy in adolescence comes with negative effects, it is critical that the adolescent people are assisted to willingly or enthusiastically prevent or delay pregnancy by means of abstinence from sex and, for that matter, sexual intercourse. The adolescents can also be helped to willingly use other reportedly useful contraceptive tactics. Ladies and gentlemen, did you hear the word sex? And what about sexual intercourse? Can you compare and contrast the word sex and sexual intercourse? Are you aware that there is some difference between the word sex and sexual intercourse? Present your answer as a comment after enjoying this section. Over the years, contraceptives, which have been reportedly found to be safer and suitable to be recommended for the adolescent population to use, are combined oral contraceptives, male and female condoms, Depo-Provera injectable 1, implants, and progestin-only pills, among others. Some authorities are of the opinion that intrauterine contraceptive devices are good for the adolescent persons when they are in a stable, mutually monogamous marriage. They also say that the lactational amenorrhea technique, I beg your pardon, they also say that the lactational amenorrhea technique is good for an adolescent girl when three important conditions are fulfilled. The first important condition is that she should be under 6 months postpartum. Did you know the postpartum period begins soon after the baby's delivery and characteristically lasts 6 to 8 weeks and ends when the mother's body has almost returned to its pre-pregnant state? There are 3 distinct phases of the postnatal period. the acute phase, lasting for 6 to 12 hours after birth, the subacute phase, lasting 6 weeks, and the delayed phase, lasting up to 6 months. And we have just established the fact that the first important condition which should be fulfilled before the lactational amenorrhea technique will be good for an adolescent girl is that she should be under 6 months postpartum. The second condition is that she should be fully or nearly fully breastfeeding. And the third condition is that she should be amenorrhoic. And in case you do not know, the word amenorrhea is the absence of menstruation, and it is often defined as missing one or more menstrual periods. Ladies and gentlemen, abstinence from sex, including sexual intercourse, is suitable for those adolescent people who have not yet started sexual activity, and even those who are already sexually experienced. Although abstinence is not necessarily a simple thing, it is possible, and many people willingly or enthusiastically choose to abstain from sexual intercourse until they are legally married. Great. Did you know abstinence is the most appropriate method for adolescents in the sense that it provides protection against HIV or AIDS and other STIs? I repeat, abstinence is the most appropriate method for adolescents in the sense that it provides protection against HIV or AIDS and other STIs. Friends of Daniel Hayford, it is recommended by several authorities of the adolescent sexual and reproductive health arena that emergency contraceptives should be made available for the adolescent girls who have unprotected sex, and that emergency contraceptives must be used within the first 120 hours or 5 days after unprotected sexual intercourse. Ladies and gentlemen, there are several useful traditional practices around the world. Some of such practices are celebrations which reward adolescent girls for keeping their virginity and welcome them to womanhood. Puberty rites in which adolescent boys are taken through training sessions during which they are trained to learn sound survival strategies, as well as breastfeeding and relieving of women from work after delivery. However, there are what we call harmful traditional practices which do affect the health of adolescent people to a considerable extent, and they need to be abolished now. Among the harmful traditional practices which are affecting our adolescent populations of the continent of Africa and other parts of the world, forced marriage or marriage by abduction, early or child marriage, polygamy, and female genital mutilation or FGM have very negative impact on sexual and reproductive health of adolescent victims. I repeat, among the harmful traditional practices which are affecting our adolescent population of the continent of Africa and other parts of the world: forced marriage or marriage by abduction, early or child marriage, polygamy, and female genital mutilation have very negative impacts on sexual and reproductive health of adolescent victims. Ladies and gentlemen, societies have peculiar reasons for practicing such harmful traditional practices. The reasons for practicing female genital mutilation, for example, include: 1. Hygienic and aesthetic reasons, that is, to make the adolescent girls hygienically clean. 2. Psychosexual reasons, that is, to control the sex drive which characterize uncircumcised girls. 3. Sociocultural reasons, that is, to ensure adolescent girls' virginity and accordingly their family's honor. And 4. Spiritual and religious reasons, that is, it is required by their religion. Did you know there are parents, guardians, and other caretakers who prefer early marriage for their daughters? One of their reasons is that it will make it possible for them to see many grandchildren and possibly great-grandchildren before they die. Furthermore, early marriage is desired by some parents and guardians because they think that it will ensure that their daughters are virgins at the time when they get married and thus live up to traditional expectations. Nevertheless, each and every one of us here in Africa and those abroad need to recognize the fact that harmful traditional practices do pose significant multiple negative health consequences for the adolescent population, and if they become pregnant in the process, for their children. Such consequences range from long and short-term physical problems such as: 1. Unintended and unwanted pregnancies; 2. Unsafe abortions, which may lead to malfunctioned womb and related problems; 3. Severe pain; 4. Bleeding and therefore anemia due to such a physiological issue; 5. Deadly and or detrimental sexually transmitted infections; 6. Psychological issues like mental disorders, for example, depression; 7. Social consequences like limited educational opportunities; and 8. Economic consequences such as not gaining gainful employment. Ladies and gentlemen, harmful traditional practices and complications which result due to them are absolutely preventable. Nevertheless, it is not a simple venture to change traditions which have been practiced for a long time and passed from generations to generations. This is the reason there is a need for counselors, healthcare providers, parents, guardians, journalists, and other relevant stakeholders to do everything possible to increase awareness about the bad consequences of harmful traditional practices and also the legal implications of such practices. Ladies and gentlemen, what do you think should be the role of the chief thing in handling, that is, abolishing harmful traditional practices? Leave your answer as a comment. Ladies and gentlemen, the terminologies gender and sex are mostly often used interchangeably or synonymously. Nevertheless, the term sex is the biological characteristic feature which defines a human being as being a male or a female. In other words, based on the term sex, a human being is either a male or a female. On the other hand, the term gender refers to socially and culturally defined roles for males and females. Dear friends of Daniel Hayford, I would like to talk briefly about gender-based violence or GBV. Did you know the expression gender-based violence can be defined as any form of intentional or deliberate physical, psychological, or sexual harm or threat of harm which is directed against an individual on the basis of his or her gender? Ladies and gentlemen, the consequences of gender-based violence could include 1. Increased risk of STIs like syphilis, gonorrhea, and HIV. Number 2. Unintended and or unwanted pregnancy. 3. Unsafe abortion. 4. Avoidable or unnecessary safe abortion. 5. Physical injuries. And 6. Psychosocial trauma, including fear, anxiety, and depression. Each club, union, society, community, village, city, district, municipality, region, country, continent, and all humans in the world at large are expected and required to be mobilized and educated in the combat against gender-based violence throughout the world. Furthermore, males and females should be equally involved in the combat against gender-based violence throughout the world. Ladies and gentlemen, anybody who has encountered and suffered from any form of gender-based violence, especially rape, should be counseled, referred to a health facility, including health posts, health centers, or hospitals, and be supported to report the case to the police. Ladies and gentlemen, adolescent-friendly sexual and reproductive health services refer to the adolescent sexual and reproductive services which are accessible, which are acceptable, and appropriate for the adolescent population. I repeat, ladies and gentlemen, adolescent-friendly sexual and reproductive health services refer to the adolescent sexual and reproductive health services which are acceptable, which are accessible, and which are appropriate for the adolescent population. The characteristic traits of adolescent-friendly sexual and reproductive health services do relate to the service providers themselves, the health facility itself, and the program design. Ladies and gentlemen, the service provider characteristic features are specially trained staff, respect for adolescent people, privacy and confidentiality, and adequate time for adolescent I beg your pardon, and adequate time for client-servant interaction, among other things. The facility traits are convenient space or location, convenient hours, affordable surroundings, and peer counselor availability, among other relevant things. Lastly, the program design characteristic features are engagement of adolescent people in their planning and implementation, no overcrowding, short waiting time, affordable fees, wide range of services available, and opportunity for referrals. Dear friends of Daniel Hayford, services which are intended to be provided in adolescent-friendly sexual and reproductive services delivery are information on family planning, counseling on family planning, promotion of healthy sexual behaviors, sexual and reproductive health issues, management of STIs, antenatal care, postnatal care, delivery care, prevention of mother-to-child transmission of pathogens, post-abortion care, testing for HIV, testing for hepatitis, testing for pregnancy, and referral services. Did you know there are various factors which do affect the use of sexual and reproductive health services by the adolescent population? Such factors include individual, institutional, and sociocultural factors. Counselors, especially those who are healthcare providers, do have critical roles to play to help in reducing these barriers to service utilization. There is a need for a counselor of adolescents to do well to establish appropriate rapport while interacting with adolescent people in order to correctly identify and respond to their needs. A counselor may decide to employ the HEADS, HEEADS assessment for proper history taking in an adolescent counseling. Note that HEEADS HEAD is an acronym for home, education or employment, eating, activity, drugs, sexuality, and suicide or depression. A counselor may decide to employ the HEEADS assessment for proper history taking in an adolescent counseling. Note that the HEEADS is an acronym for home, education / employment, eating, activities, drugs, sexuality, suicide or depression, and safety. Thank you very much for listening. See you in the next session on the last part of the theme, an overview of adolescence and reproductive health. Great gratitude.